I think Senator Murray really put this fight into context. This isn't a fight that started with the Republican budget, which started out as the Ryan budget, is no longer the Ryan budget. Every single Republican in the House, save 4, voted for that budget. It is theirs. They can run from it, but they can't hide from it. They have their fingerprints all over it. Not one Democrat voted for it, and we're going to stop it in the Senate. I had some press person come up to me and say, well, isn't this just, this thing is dead, and why are you even bothering to have a press conference? It's very much alive, because that budget passed the House, and it's sitting on our desk. It is very much alive, and we need to kill it, and we're going to reach out to our colleagues and say, help us put an end to it. Now, let me tell you, the Republican budget is a disaster for all seniors. 56% of those on Medicare, and I'm going to talk about Medicare, 56% of those on Medicare happen to be women. So we're here, women of the Senate, with our friends, as Senator Mikulski says, our Sir Galahads who are by our side, to say that this will not stand. Now, 15 years ago, I can't believe it was that long ago, that Newt Gingrich said Medicare should, quote, wither on the vine. Some of you were in high school at the time. But now, the new generation of Republicans, they just want to kill it outright. They say, not enough, withering isn't good enough. We want to kill it outright. And that's what their budget does. Now, let me tell you how. My first chart that I want to show you, a devastating cost increase for seniors. Take a look at this. The average income of a senior woman, that's actually the median income of a senior woman, is $14,430 a year, okay? That's a fact. The health care costs under the Republican budget for that woman would be $12,500. She wouldn't even have $2,000 for the rest of the needs of her life. This is really a sick proposal. A sick proposal. That's what it means to the average woman. Now, I also want to show you, well, that's, by the way, that $12,500 is double the health care costs that they pay today. So I would ask you a rhetorical question, and then I'll answer it. Who in their right mind wants a senior woman living on $14,000 a year to pay almost all of that for health care? That's my question. The answer is House Republicans. That's what they voted for last month, and any of them who vote for it here in the Senate, that's what they're saying. The average senior woman in this country would spend almost all her money for health care costs, assuming she can even get insurance. Now I'm going to show you the next chart that shows you a very happy man. This very happy man is the CEO of insurance company. Now his average salary is $12.2 million. You hear me? The average senior woman is $14,000. His average is $12.2 million. Just the people the Republicans want to help at the expense of all of the senior women. Look at this. Profits in the last year, up 41% from the previous year. Average income 12.2. Now let me just be clear. There is no Medicare benefit to seniors under the Republican budget. The benefit goes directly to him. It goes directly to the insurance company. Just so you know, it doesn't go to the senior. It goes directly to the insurance company, and their overhead is 20%, 30%. Medicare's overhead's like 2%. This is what the geniuses over there are putting forward. Disaster. And the last chart I will show you, and then I'll close. Look what happens. Look what happens to prescription drug costs. In my state, 400,000 Californians who fell into that non-coverage piece, they are made whole. And Senator Stabenow has taken such a lead on this, and we've all helped her to finally say, that's ridiculous. You reach a certain point in your reimbursements for your prescription drugs, and then there's no reimbursement. What does this translate to? We took care of that in the health care bill. They repeal it in the Republican budget. So I have 400,000 Californians, almost the size of some small states, who will pay $9,000 more over the next 10 years for their prescription drugs. What are we doing over there? It's crazy. So we're not going to solve our problems by driving our grandparents and great-grandparents into dire poverty. We're not going to solve our problems by taking their Medicare benefit and giving it to some corporate executive at some insurance company who's laughing all the way to the bank. We're not going to solve our budget problems by taking away health care so that our seniors get desperately ill and they land in emergency rooms all across our great nation. Let's defeat that Republican budget and let's reassert our support for Medicare.